All right, welcome to the Autoimmune Doc podcast. As always, I'm your host, Dr. Taylor Crick, and I love teaching people about the underlying mechanisms behind chronic and complex illness. And that is the theme of my podcast. So if you've listened to the show before, you know who I am, and you know kind of my philosophy and the way I look at things. But if you're interested in the mechanisms behind chronic and complex illness, nothing is more fascinating than mold. And everybody that's heard this podcast knows that I'm a big mold guy and I'm knowledgeable about mold, but it's also not just mold, it's air quality. And so I'm here today with somebody that I consider, I would call you, Dr. Dennis, like a hero in the mold world. Like your face would be up on the mold Mount Rushmore. But I'm here with Dr. Don Dennis, who's an ENT surgeon and a pretty well-known name in the mold world because of some of the products that he's formulated and developed and things like that. But you're also, Dr. Dennis, you're pretty rare in the mold world or in the ENT world that you are an ENT surgeon who also believes that mold is the root cause of many, if not most, chronic health conditions. And I think you're right, but it's pretty rare. So I'm going to do a quick introduction of my background of how I got familiar with Dr. Don Dennis before I open the floor to you, Dr. Dennis. So I apologize, but let me just kind of give you a background and give the crowd a background too. So for me, just in general, I'm like the typical ENT patient. I spent most of my childhood in ENT offices. I think I got my first set of tubes put in at 9 months, really early. They fell out, they were put back in. I was always in surgery for my tubes in my ears and ear infections, and then had my tonsils taken out. I've had my adenoids taken out twice. I've had multiple septoplasties, rhinoplasty, one of them they cut a little bit off, but mostly septoplasty. But all that comes with that too, the antibiotics, chronic sinus infections. I grew up in the 80s and it was like antibiotics were just, take them every time you get any sniffle. But that's a long story short, but I have an extensive ENT background. So I'm intrigued by what you do just because of my history of sinusitis. But then later in my 30s, which I'm now 40, I just turned 40, but later in my 30s, so in my adult life, it got even worse. I developed nasal polyps. I developed asthma, which was weird. I developed hypersensitivity pneumonitis. And long story short, it was all from mold. And so I already practiced at that time functional medicine. I had a pretty great deal of knowledge on mold and mold toxicity and was familiar with your, company Microbalance, Dr. Dennis, and EC3 products, but not as much until I lived it. But then I really lived it myself too. So that's a really long story made really short. But I think that in functional medicine practice, in wellness practice, in whatever we want to call it, in being healthy, I think that air quality matters more than it's given credit for. I think it matters more than basically everything else. I think it matters more than food quality. I think it matters more than a lot of these other things because we breathe, so often, and it's our first exposure to a lot of, toxins, whether it be mold and mycotoxins or VOCs or exhaust or wildfire smoke or whatever. But I don't think it gets the credit that it deserves. I think that everybody in the wellness world talks about diet and leaky gut and red light therapy and MTHFR and all these, trendy novel things that I'm all for all those things. And I'm really knowledgeable on all those things. But I think that the most important thing is we need to breathe clean air. And so that's how I was led to Dr. Don Dennis. Molds and other airborne toxins drive epithelial inflammation, which drives neuroinflammation and drives histamine and mast cell activation and leads to leaky barriers, depletes our antioxidants and all these things. And so now, we sell quite a bit of, your products, Dr. Dennis. So like the EC3 candles, the sprays, they're really popular. People really enjoy them. We own two of your foggers. So we rent them out to people and we sell the EC3 concentrates. And so people, clinically and retail wise, I have a retail vitamin supplement store. They really love your products. I also own an ionizer that I learned about from you, but I've really enjoyed, following you throughout the years. But now I just want to open the floor to you. But another thing I want to say before I open the floor to you, we were just talking about this a little bit. And so one of the things that you just said that just is sticking with me is how these mycotoxins from mold store in the tissue. And so when you, as a surgeon, biopsy that tissue and you put it in an agar plate, you can see the mycotoxins begin leaching out. So I think that that's fascinating. Now, Again, I don't want to jump too much, but I want to open the floor to you to just kind of talk about your background, who you are, what you do, what led you to where you're at now. Because again, it's pretty rare for an ENT surgeon to be preaching about mold toxicity, the importance of clean air, how mold affects the sinuses, biofilms or toxin accumulation. And again, go wherever we want with this, and I can guide you with questions, Dr. Dennis. But that's just kind of my intro to you. So welcome to the show, and thanks. We're happy to have you on here.
Well, thanks for having me. I enjoy teaching. I'm an ear, nose, and throat surgeon and trained at Johns Hopkins Hospital, which was the first hospital training center that ever offered ear, nose, and throat training. So they developed ear, nose, and throat training, and it's spread throughout the world. So I got the best training you can get in the world. And then when you're in a clinic, you're seeing patients for about 3 months, and then you go to another service with other problems and learn about those. So when you get out, you haven't had a history of seeing patients for long periods of time. So you believe that what you learned how to treat people will get everyone well. And when you get into private practice, you realize that's not correct. So I had one patient that we did everything known to man. He was always infected in the sinuses, and we did everything you can think of. We did surgery, irrigations, antibiotics, steroids, you name it, we did it. It didn't matter what we did. This guy never got any better. And so one day, the same guy comes in, and his endoscopic exam shows he is totally pristine clear. And I knew it wasn't anything I was doing.
Hmm.
So I said, "What have you been doing?" Because I wanted to learn what he did. He says, "Well, we just went to the beach for 2 weeks, and I felt a lot better." So then I knew it was environmental. And then we figured out it was fungus. And then after that, that's how it all started. So then I decided that most of the chronic sinusitis in humans was due to an immune reaction to fungus. So I knew that intellectually. And then 10 years later, uh, Mayo Clinic came out with 23 papers that proved beyond the shadow of a doubt that mold was the cause of chronic sinusitis in 93% of the cases. And the way they proved it beyond the shadow of a doubt is they took the white cells from people who had chronic sinusitis, and they incubated those white cells with fungus. And they chose Alternaria because it's the most uh, antigenistic inflammatory fungus. It's not the most toxic one because it's the most inflammation.
Okay.
So the white cells of chronic sinusitis patients secrete three inflammatory mediators: interleukin 5, 13, and interferon gamma. And that's what caused the eosinophils to come in to try to destroy the organism. And they ruptured and released major basic protein, which destroyed some of the mucosa microscopically and put pits in the lining. And those pits in the lining collected mucus, and that mucus got infected because the cilia wasn't moving the mucus out. So everybody was jumping on the bacterial infection while all along it was the mold causing it. So that's why it kept being chronic over and over again. So then they took the white cells of patients who did not get chronic sinusitis, and their white cells did not secrete any inflammatory mediators. So that was the difference. But the answer to that by other ENTs and other physicians was, well, we know it's not fungus because all the people in the house aren't sick. It's like they didn't hear the first part. It showed you why. It's an immune reaction that's genetic, and you can't fix it genetically. So you have to fix your air. So basically, we're all breathing about 3,000 gallons of air a day.
Jeez.
That's a lot of air, but you're only washing out with 8 ounces of salt water. So who's going to win? The air always wins. So if you think about health simplistically, and I like to get everything simple, what are you taking into your body? The most volume is air. The second most is water, and the third most is food. So it's in that order.
Yeah. Okay. Yeah.
They got to get it right.
Yeah.
So you got to do all three. But if you just do food, you're not going to get anywhere because you didn't do the air.
Yeah. Well, and I think that too, just to parlay on some of the things you're saying, but like a lot of people don't know that our sinus and lung epithelia has higher glutathione concentrations, higher cytochrome P450 activity. It's detoxifying because it's the first contact with a lot of, toxins that we're exposed to.
That's
Um,
true. That's right.
but yeah, so that's interesting.
So so then we operate on these patients and try to get involved in the environment. So along the way, we figured out we tried to get some kind of definition for clean air, and it's going to morph into other stuff. But basically, we found out uh, the clean air definition was under 50,000 particles at zero point 0.3 microns per tenth of a cubic foot. Now that's pretty detailed, but on a measurement device, that's what we found. The sick people get sick at that level
Okay.
when you exceed that level. So now the people who make the instrumentation have normal ranges. Those ranges are incorrect for humans. Uh, that what they did, they're all scientific people, so they wanted to get something that you could measure. So they took the ratio of the outside air to the inside air, which is a good idea, but it has absolutely nothing to do with human health. So the measurements that the people who make these measurement devices consider to be normal are not good enough for the mold patients.
Okay.
They need to be lower than that. And
And
that's
you're talking just about particulates, not necessarily
particulate.
molds and
Yeah,
micro
not
that
measuring anything else, just particulates.
yeah, which could be
Measuring VOCs and all that stuff.
yeah, which could be dust or wildfire smoke or auto exhaust or
That's
things
that's
like
right,
that.
just
Yeah.
particles.
Yeah.
And so that's like a starting place, but then you can get into to the weeds later on. But if the person has not got good air, there's no way what I do will help them.
Yeah.
I'm guaranteeing them a 100% failure rate of treatment, of all treatment, surgery, everything.
Yeah.
So, uh, and so some people want to come anyway.
Yeah. Of course.
And so, if you come, you're wasting your time and your money because I'm guaranteeing you failure, but they still want to come.
Yeah.
Just
Well, and
get it to
and
good air first.
if somebody has chronic sinusitis issues, they still probably need to come to you, right? They just need to fix the air first, right? They need to fix the air
That's right.
and
That's
then
right.
clean the
I'm talking
sinuses
about
out of it.
people, who
Yeah,
may
who?
be blind, deaf, can't get up out of the wheelchair, really sick people.
Yeah, yeah, yeah. Okay.
Parkinson's, total cognition blanked out, I'm talking about really sick people. They're looking for help, and I can give them the help, but they got to first follow instructions on getting the environmental straight. And we got a couple of companies we use that go all over the country, but they can't go everywhere. Some of my patients are from Europe and other countries.
Hmm.
So that we have to have a way that these people can get healthy. And I say, basically, just do some common sense. Let's say you can't stand up to start with. That's severe neurological toxicity.
Hmm.
Okay. So if you have a person like that, my advice is step one is get into a place. Don't take anything with you from that house, but get into a place where you know you're getting better. That's step one.
Exactly. Yeah.
And if you do that, then all the treatment will work. And then you can worry about fixing the house later. But the chance of fixing a house good enough for somebody with severe neurological symptoms is low. Now,
Yeah.
it's possible, but it's low. And the reason is, and I didn't believe this for years, but the mycotoxins go into, not on top of, the wood and the flooring. They
Okay.
go into it.
So tell me about that too. And let me just explain this to the listeners too.
Yeah.
If you've heard my podcast, but molds release toxins called mycotoxins, and they're microscopic. They can be airborne. They don't smell. They can stick to clothes and bedding and can come with you. But what you're, and they can also, Dr. Dennis, like we were saying earlier, they can get into the tissues. They can store intracellularly, and they have some mycotoxins have an indefinite existence intracellularly, so they can get into the tissues. But what you're saying right now is the mycotoxins can also get into the tissues of your home. They can get into the beams and floors. Is that what you're saying?
That's right. And so the example I give is, let's say you had a house fire. You put out the fire, you got everything out of the house. In the next few days, you walk back in there, you smell smoke. That's what we're talking about.
Yeah.
Smoke has penetrated everything, even though there's not a stitch of anything left in there.
Yeah. There's nothing burning, no fire. Yeah.
There's nothing in the house. It's all gone.
Okay. Yeah.
You still smell smoke.
Hmm.
And so mycotoxins are a lot like that, but you can't smell them. They go into the wood, not on top of,
Okay.
you know, and then they leach out later on. And the way I figured this out was I had a patient who had moved out of his house. He got well. He was doing very well. And then he got sick again. And then I asked him, okay, what have you got from the moldy house that you brought into the clean house? He said, well, I got my desk, but listen, I took it out in the yard. We really scrubbed it. We took all the drawers out. We did it upside down, backwards. We scrubbed it 2 or 3 times really diligently and put all your EC3 stuff all over it and did all this stuff. And then I figured it was okay. So I put it back in there and I sit at the desk, every night. I said, okay, just do me a favor. Take it out of there and see how you do.
Hmm.
And so he took it out, he got well.
Yeah.
So then I knew you can't fix it
Yeah.
for
Well,
that type of
that's
patient.
interesting because even in the mold world that you and I live in, it's
Yeah,
commonly said that hard surfaces are pretty safe to take with you.
that's right.
The
That's right. That's what I used
porous,
to think.
yeah, yeah, yeah. So the porous things we think are more damaging and probably still are. A porous
Yeah.
fabric couch or clothing or things like that. Things can obviously get stuck in the fibers, but that's pretty fascinating. And I'm sure you and I both, we could trade thousands of mold stories like that. It's so fascinating to see, because there's so many people out there that don't believe in it. It's like if you spend one day in my practice, you believe in it pretty quickly because we see it just all the time and we see it work all the time too. So,
Well,
um,
when you see patients who are like blind, deaf, and paralyzed and have tremors, and you get them back to normal life, you become a believer.
exactly. And it's amazing. Yes. Yeah. Yeah. So talk to me about the difference in a human between immune reactivity, which there's different types of immune reactivity, and there's IgE versus IgG versus innate immune reactivity and different things like that. But you're reacting to something in your environment versus colonization. Colonization meaning something's living inside you. These molds or bacteria or biofilms or whatever have colonized your sinuses. And I know that if we were have more visual, you've got great CT scans and things like that, but what, in your opinion, is the difference, or how do you differentiate those clinically between just an immune reactivity, like the guy sitting at his desk, versus colonization, meaning mold living inside the body that needs to be flushed out or killed? How do you differentiate that, or
Well,
what's your take on that?
well, you do two things. First of all, you do an endoscopic exam. So we have little flexible scopes, like 4 millimeter scopes, that we can go inside the sinuses through the nose and look at the nose, the eustachian tubes, the larynx, the vocal cords, the trachea, look at everything.
Uh-huh.
So you can see the nature of the tissues. So normal tissues are this pink, healthy color with no redness and no vascularity. So when you look at one of these mold patients, the tissues are all swollen. It's draining a lot of mucus, and it's red like you just breathed some chili peppers. You know,
Okay.
it's red and inflamed, and a lot of times they got thick mucus. And if they have surgery before, you can see inside the sinuses. A lot of them will have these little punctate. Punctate means period shaped, little round things. Punctate hemorrhages. They're submucosal. It's just like little blood blisters.
Mm-hmm.
And they'll have these throughout the maxillary and ethmoid sinuses. And
Okay.
that, most of the time, that's fiberglass from inside the duct system. But
Okay.
it,
That's
but,
interesting.
but it can be other particulate, not fiberglass, but most commonly is fiberglass. So then you know where it's coming from. So it's either from the attic or it's typically a lot of HVAC people line the duct system with fiberglass. They do that when it's being manufactured to save time sending it wrapping from the outside.
Okay.
But you can't, humans should not be allowed, they shouldn't be allowed to manufacture that stuff. Anything inside a duct system is wrong. It should be outside, wrapped around the outside of the duct system,
Okay.
because eventually it's going to rot. It's going to degenerate, it's going to flake off. And if you have an air conditioner, it's going to be humid, it's going to be damp. So it's all going to grow mold. And so you look at a duct system that's got fiberglass lining, it's all black in a couple of years. It's just totally black. And all the mold is flaking off in there. So,
Okay.
uh, and then the fiberglass puts the ulcer there because the eosinophils come in to kill the fungus. They kill the fungus, but they can't kill fiberglass. So they keep coming until they dissolve the mucosa
Ah,
down to bone.
okay.
Now you got exposed bone inside the sinus, and you can't get any eosinophils there. So the only solution is you got to fix the air. You can't get somebody well in that environment. So
Okay.
you got all the duct system has to be ripped out, and this is common, especially in the South and in Florida. They use fiberglass everywhere.
Uh-huh.
So fiberglass is like honey for fungus. They love it.
Okay. I've
So
heard that about, drywall and drop ceilings and,
that's right.
different building
All that stuff is
materials,
like
but
that. Yeah.
okay. Yeah.
All that stuff is like that. So, and you don't want to expose fiberglass insulation in your attic. It should be covered. Sometimes they cover with paper or whatever, but sometimes they make it this in. John Manville makes it inside a plastic covering, so it's wrapped in plastic 360.
Uh-huh. Okay.
Then you never take it out of the plastic. You just unroll it, and that's it.
Yeah.
So that's the best. But what happened was the uh, the blow-in is so cheap and so much less labor intensive that all these builders just blow it in.
Mm-hmm.
Well, that's like just killing everybody. So it's just ignorance. They just don't know any better.
Yeah, well, and it's crazy too because I have friends in the building industry and HVAC industry and things like that, and they say that people are starting to be aware that building practices are I don't know if they use the word killing people, but they're airtight, they're energy efficient. All these problems health wise with the air quality and otherwise
You don't
are
want it
just
to be airtight. You
yeah,
want it to be.
exactly. You want yeah, yeah. So what about colonization? You're talking about fiberglass and how it can damage and cause these little ulcers and things like that, and that makes sense to me. But is it true that, if there's mold in your environment, the spores are airborne, you can breathe those, you can measure those on testing, things like that, but they get into your sinuses. I've always said mold likes dark, warm, moist places.
That's
And
right.
so it likes sinuses and tonsils and things like that. So you see that sometimes on the endoscopic exam.
Yeah. And so the difference is 80% of the population does not react to the organism when it enters the nose. Everybody's breathing mold
Right.
because you're breathing air, but it's not toxic levels. So 80% of the population breathes the mold in, it gets on the mucus, and the cilia move it all along, goes to the stomach, and the acid kills the mold. But 20% react to the mold with the eosinophils. And when that happens, you make a pit in the lining, and then the mold sticks there. Or you get swelling in response to the mold in the mucosa, and the mold sticks there. It can't be bathed on by the mucus.
Right.
So it sticks there and then it starts to grow because it's got everything it needs. So it starts to grow and colonize, and it gets inside the ethmoid sinuses because ethmoids are the ones between the eyes, and it's a it's a cylinder with 8 air cells in it,
Okay.
and it's about 7 centimeters long. It's pretty long. It goes from
Pretty good
the
size.
eye all the way back to the sphenoid sinus.
Okay.
So think of it as a cylinder parallel to the floor with 8 air cells in it. And the air cells are all different. It's like fingerprints. Everybody's got different structured air cells. So then you got 8 air cells inside a tube. Well, there's 8 rooms for them to hide in.
Uh-huh.
And then they get in one of those rooms and they start multiplying. And then what do? They make mycotoxins. So the mycotoxins go from the sinuses into the brain, uh, just like a gas would.
Yeah.
And so if it's in your urine, it's in your brain 100% of the time. And people just don't realize that, but
Yeah. And there's a
it
lot
is.
of, again, we talked about this before we hit record, but there's a lot of different opinions. Some people say urine testing is worthless. Some people say, there's just different opinions. And I think they all have some value to them. I don't think that urine testing is always perfect, but it's still a test and it's still valid. But that's interesting to hear your opinion on that. Because I mentioned, but again, before the call, I've heard you say before that you might have three mycotoxins on a urine test. But
Right.
there might be 11 of them in the brain. It's a toxic soup up there. You're not always seeing a complete picture on every time you pee, but you're at least confirming that there's mycotoxins in the brain.
Yeah, you just want to know if any are there.
Exactly.
Because if any are in your urine, you got a lot more in your body. It's just yes, no. You want to yes, no.
Now,
If it because when we did AI, artificial intelligence software, we haven't published this yet, but you can see the mycotoxins in the brain on an MRI scan
okay,
if you use these algorithms.
okay,
So, and then we use that visualization to know which therapy is effective
yeah, okay,
getting out of the brain. So we can
yeah.
see it leave the brain.
So
So,
what are some of the therapies that might be, available for that, Dr. Dennis, whether it's in your ENT surgical office or some of the products you've developed or just some of the things that are out there. But, if you confirm that, what are the next steps?
okay, so one of the major things, if you've got neurological symptoms, or you've got a positive urine for mycotoxins, you know it's in your brain. So you want to get it out of the brain. Well, the number one thing that gets it out of the brain is oxygen.
Okay.
Uh, and you got to do 8 liters a minute, 100% oxygen for 2 hours a day on a face mask, not nasal cannulas, and not a rebreathing mask, just a regular face mask. And it's even better if you're doing something else, like on a treadmill or a bicycle, but you don't have to. Just sitting down reading a book, just put it on. You don't have to spend 2 hours extra.
Mhm.
And some of these patients are so sensitive, they do 15 minutes, they feel really like crap. And so that's your time. You stop at 15 minutes. That means you're pulling it out faster than you can assimilate it.
Right.
So you have to just listen to your body. But eventually you can work up. So oxygen, basically think of it like this. The toxins are very caustic, like vinegar. You squirt vinegar in your eye, what's it going to do? Slam shut and start watering. Well, inside the vessel wall, the mycotoxins irritate the vessel wall. So it swells shut. The capillaries do, and you can't access the toxin. So you got to open the capillaries first, and then all your medicines get in and do the job.
Okay.
But now, does it mean medicine's not going to work? It still works to some extent, but not as good as oxygen. But the drugs we use, very common ones, we have a microbalancer. You can get it anywhere, basically. Uh, Glutathione is a basic one. And you can dose it up, dose it down, depending on your sensitivity level. Glutathione, NAC, is really important. And then we use the liver cleanse, which is, several products for liver cleansing,
Mhm.
herbals. And then the thing that we don't sell, but I like this the best for, a multivitamin, Intramax.
Okay.
Now, Intramax it's only got 415 items in it. That's all it's got. Just 415.
Yeah. Just a
Uh,
few, just a couple.
and it's bound to carbon. And so the vitamins go intracellularly quickly because the cell assimilates those. And then it drags in the carbon with it, and the carbon takes the toxin out of the cell. So that's how it works. Now, most people don't have any trouble with it, but the one I recommend is the new one is called Intramax 2.0, and it says unsweetened. So
Okay.
you don't want the one full of sugar. So that I'm not selling that stuff. I'm just telling you that's very
Sure.
effective. Instead of having 50 million ballers in your house, that's a good way to get things down and
Yeah.
focused.
Yeah. Well, and again, as a mold person who owns a vitamin and supplement store, and who's been in this game for, a decade or more, I've tried them all. There's a million of them out there. There's different binders, there's different glutathiones. We
That's right. That's
carry
right.
we carry 600 or 700 different products on our shelves. So, but there's a lot of people come to me with duffel bags full of stuff and they're not getting any
Yeah,
better.
that's
And
right.
that's when we start thinking, well, what are you exposed to, or what are you living in, or what are you missing? Because a lot of times there's some missing piece, like an environmental thing. What are, just to segue, we're talking about detoxing the brain and, glutathione, NAC, things like liver support, things like that. What are some other things, again, from your product line or otherwise, that people can do? Like, I'll tell you, I've used Citri drops and I've used all your EC3 products for many, many years, but I also, and I don't know if you'd agree with this or not, I had tremendous success using essential oils in a neti pot, to get rid of what I believe would be fungal colonization. But I think in your model, using the rinse is more just getting particulate out, just using saline to just get particulate out. But I had used essential oils with that. But what are some other things that people can do,
Well,
whether it's
there's nothing wrong with essential oils. You have to be careful though.
exactly, there can be a little noxious.
It's very little, very small amounts.
Yeah, and if you do too much, I always tell people, if you do too much, you're gonna burn. Your body's gonna let you know really quickly.
Well, not only that, you can damage your smell with some of those things.
Okay.
So you can knock out some of your olfactory nerves if you do it to a higher concentration of the wrong products.
Okay.
So generally, herbals are fine, but you got to get very dilute and small amounts when you put it in the nose. If it burns, you got too much,
Hmm.
and just stop right there. And I would try one thing at a time. Don't do five or six. Just do one thing at a time and see what you tolerate, and what works good. Now, what the one we have, Central Drops, is I got four different seed extract, fruit seed extracts, and they're antifungal, viral, and bacterial. Well, when you put four together, you exponentially uh, improve the kill rate on a product like that.
Okay.
It's not linear; it's exponential when you add those together.
Okay.
So it kills just about everything you can think of, and you can actually drink it. You not straight; you have to put it in water. But we
And you
put
can use it topically and things for ringworm and there's other applications, right?
That's right. And I like to have people use it to wash their vegetables with and fruits.
Okay.
You just pour 10 drops in a bowl of water and throw your stuff in there and slosh it around. It takes everything off of them. And then you can just eat them. You don't even have to rinse them off. You can rinse them off, but I mean, you leave a little bit on there, it might be nice.
Yeah, it's fine.
So then what's the next thing?
Other things, what is your thoughts on nebulizing compounds, whether it be for colonization, or nebulized
What's the
glutathione, or
I would put the Citra drops, 3 or 4 drops, and just see if it burns. That's too much for you. But you can go up to 6 or 7 drops. But start with about 3 and 8 ounces of salt water.
okay.
You got to use distilled water. If you can't get distilled water, try bottled water. But don't ever use filtered or tap water for right
Okay.
now.
Okay.
Some of the filtered water is okay, but you kind of rolling the dice because
Uh-huh.
sometimes they don't change the filter.
Sure.
So start out with clean so you've got the right stuff. So you have a problem, you know what it is.
Okay.
So distill water and you put, it comes with little salt packets. It's called a Nasopure.
Yep.
And then you put the salt packet in there, shake it up. And then when you put it in your nose, it's a gentle squirt. You don't slam it. And you aim for your throat versus your eye. Everybody aims for the eyeball. You want to aim towards your throat and do it squeeze it in, then blow it out. Everything's gentle,
Hmm.
not slamming it. And then you do the other side, half the bottle on one side, half on the other side. Then you use the Citrodrop nose spray. It's got all the antifungals in it. And that combination works for most people.
Okay.
And then the others, what was the other stuff you said?
Well, I was just asking you for what some of your favorite tools were, whether, outside of the clinic, with regards to nasal, surgical procedures and things like that, what else people can do to clean that area out or keep that area clean. What about
Yeah, and then you can use the Citra drops. You can start out with 3 or 4 drops and 3 ounces of water. Let's say you got a sore throat.
Mhm.
put about 3 to 5 drops in 3 ounces of water, and then put a small amount in your mouth and gargle with it. It's really nasty. It tastes very nasty. Gargle with it and then swallow it. Your sore throat's going to be gone when you finish that 3 ounces.
Okay.
Uh, it just decimates it, and then follow it with pure water so you rinse the bitter taste out of your mouth.
Yeah.
That's a treatment as soon as you start getting a sore throat, if you hit it with that, it won't go any further.
Well, and I think, Dr. Dennis, that it's interesting because, nobody talks about these things that often, even in the alternative world, but tonsils have biofilm on them and bacterial
That's right.
colonization on them. And so you can have pharyngeal biofilms, you can have inner ear biofilms, you can have it in these different areas. It's not just all in the gut or it's not just all in the sinuses. But doing some things like gargling or nebulizing might hit these different, areas that a nasal rinse might not hit. Does the nasal rinse get to, ethmoid and some of those other sinus cavities? Or is it
Uh,
more just,
it can reach there, but scanty, not
yeah,
very
that's
much.
kind of what I would have guessed or
Uh,
assumed.
yeah, and that you can't get drugs in there. You can steam and you can mist, and you can get it in there a little bit, but you can't really penetrate the ethmoids that well. Now the
Is
frontal,
that is that where a surgical procedure like you do, is that where that would come into play because you can't
yeah.
get in there?
Well, when you do maximum medical therapy on everyone, then you CT them after they do all that. If the stuff is still there after maximum, you can't fix it.
Okay.
So then you have to clean it out mechanically.
Okay.
So now the benefit of surgery is not only that you clean it out, but that you have lifetime access to clean all your sinuses out yourself the rest of your life
Okay.
with saline irrigation. That's the benefit. And so that's kind of an advantage because it can't hide anymore.
Okay.
Now, if you get the frontal sinuses are the ones above your eyes, they're like a different breed. They're a different sinus. You can reach those without surgery, but you have to do what we call upside down drops. And we put, antifungals and xylocaine. You have to put some xylocaine in there because it burns. So xylocaine numbs it up so you can tolerate it. And then a steroid called Kenalog. Kenalog dilates all the tissues, so it drives the vehicle that you're trying to get into sinus. It dilates everything so it gets in, and it keeps it dilated. So
Okay.
the hole stays open. But you have to get like in all fours, like a downward dog, on a yoga mat.
Mhm.
Get on all fours, and then you have to get it really comfortable so you can stay there for 5 minutes. Then you have to put your head straight down 90 degrees. So your head's 90 degrees to the ground, not not less. It won't work. So then you're using the roof of your nose as a shoehorn to get right into the frontal sinus.
Okay.
The roof of your nose. So you put a dropper on in the roof of your nose and dump the whole thing in that position. It'll go directly into the frontal sinus.
Okay. Yeah,
Uh,
well, that's
it,
interesting because sometimes I see people with like frontal sinus headaches, and in certain they present in certain environments, so we're kind of suspicious of mold and we're
yeah,
suspicious of these things we're talking about. But it's like, well, especially within my scope and things. I'm not an ENT surgeon, but people are like, well, what can I do? So that's an interesting just application for
but
that.
remember, there's nothing that we have that you can get without a prescription
Right,
that
right.
you can stick in your frontal sinus
Okay. Yeah.
without a lot of pain and torment, and also
Yeah, yeah.
making it swell. You don't want to do that because
Okay.
it's going to get worse. You've got to have a numbing agent so you can tolerate, number
Yeah.
one,
Okay.
and you've got to have a dilating agent to get the drug in.
Which again, it's going to be hard to find somebody ENT wise is
You got
willing
it. You
to.
got to put those together in one thing.
Yeah. Okay.
The pharmacy mixes all that stuff for us. So they
Yeah,
don't.
yeah. But it's finding the ENT surgeon who's willing to write the script and who's willing to,
Yeah.
navigate that, which
I
that's
would, I
more
would say
more.
most of them are familiar with upside down drops.
Okay.
If they not, they teach this at seminars and stuff. They teach the
Okay.
upside down drops for if you're talking just about sinuses. But if they don't know about that, they need to go some more stuff to get some more training because
Okay.
it's been out there for years, and you can reach the sinus. And then post-operatively, sometimes the frontals try to scar. Well, if you put them on the upside down drops, it totally reverses the process. It never closes off.
Okay.
So you can save an operation with the upside down drops Now, everybody doesn't do that, but occasionally you get somebody who tends to want to close everything you've opened, and that's how you keep it open.
Okay. Well, that's fascinating. Let me ask you something. I want to end with talking about EC3. I don't know if you would call this, but I think it's kind of your flagship, product, and I want to talk about that. But let me ask you something selfishly before we get to that. I have olfactory dysfunction. I have for sure olfactory dysfunction. I didn't get it from using essential oils in an neti pot. I had it before that, and I would say that the essential oils, if anything, have probably helped it. But what are some other things involved with that? Because mine's really fascinating, Dr. Dennis. That for 10 years at least, I didn't smell a single lick, through all my kids' diaper years and all these things, which concerns me because it's a warning sign of Parkinson's and things like that. But again, my sinuses are just 100 times better than they've ever been. But what else can cause olfactory dysfunction? A lot of the things that I've done that have helped will be like just different antioxidant, therapies, whether it be glutathione or vitamin C or ketogenic diet, and they'll help temporarily. But what else can you tell me about olfactory dysfunction or things that I could consider or look into or try or
Well,
do?
zinc is helpful. Now, if you put zinc in your nose, it'll knock your smell out
Okay.
long term. But if you take it in your mouth, it helps you smell.
Okay.
So don't put it in your nose.
I won't put it in my nose.
But zinc is a good smell return. Then all your stuff that you do, but I think the main thing is irrigation. Saline irrigation is helpful,
Okay.
and and a steroid. A lot of times the olfactory cleft is swollen. In other words, the mucosa around the smell nerves is covering the area that you have smell sensation.
Hmm.
So you've got to clean the area first with saline and really diligently, just really make sure you got it clean. And then you can use something like over-the-counter Flonase. That's an anti-inflammatory to get all the inflammation out of the way. If that doesn't do any good at all, sometimes it's a mechanical issue where you just can't, you just need some more space to get to the olfactory nerve because it's totally swollen shut.
Hmm.
Uh, and sometimes surgery will help it. Sometimes there are groups of people who have permanent loss of smell. It's called anosmia.
Yeah. And
And
I don't think mine's permanent because sometimes the light switch flips back on. So
yeah, okay.
sometimes it will.
So usually that means you're in something that you're reacting to, so you're swelling the olfactory cleft so you can't reach it.
Okay.
That's most of the time it's irritation.
Okay. Well,
Uh,
that's really interesting because again, I've had a lot of my symptoms have completely resolved and they're doing so much better than they've ever been. And I feel like I can breathe easier and sleep at night and things where I previously wasn't able to. But I wouldn't say my sinus issues are perfect. It's something that I've dealt with for the last, 40 years, but that's pretty interesting. Let me use the last 5 minutes here. I'm keeping my eye on the time for your sake, but like, tell me about EC3. Now, that's a pretty broad question, but let me tell people about EC3 and then you can tell us a little bit about how it evolved. But EC3 is a product line that you have developed that is citrus essential oil based, but there are candles. In my opinion, Dr. Dennis, the candles are some of the most intriguing because they're airborne and they can get everywhere. And you guys have done some pre and post studies and things like that. And I've had many people say, like, these things work. But you also make EC3 in other formats. It could be put into a fogger. It could be used in a laundry additive, which I've got right here. You now make the wipes, which are awesome. But tell me about EC3 and that product and what it does, because my understanding is too that it neutralizes mycotoxins. So it doesn't remove them. It doesn't remove the particulate, but it neutralizes them. But what is it doing to mold's
it destroys
mycotoxins?
them. So
Okay.
basically, it's three citrus seed extracts, and we added another one in there. So uh, when you like in a toxicity profile, when you take a toxin that hurt a human, and you add one or two together, it's exponentially more toxic than linear. Like it's not two times, it's four times.
Right.
Okay, the same thing holds true with EC3. So that's why we put four different structures in there. It makes it much more powerful than one. Uh, So it removes all the mold and the mycotoxins. Now we proved that in studies with the pathologist. Dennis Hooper used to run real-time labs,
Yeah, I
and
know Dr. Hoover.
so we did these candles, and I noticed that when we did the study, all the mold would be gone from the air when retested the plates in the room. So we knew it knocked the mold out. But I want to prove it, remove mycotoxins. So he did the mycotoxin study for us, and it indeed removes all the mycotoxins from the air in a 12 by 12 space in 2 hours. That's a big deal.
It is. Yeah.
So then you know you're not breathing it.
Yeah.
The candles last for about 22 hours. So I use them when I travel because you never know what you're gonna get.
Yeah.
If I open my door and I smell anything, it's another room. I'm not staying there.
Yeah.
I use them for rooms I think are okay. I don't try to beat the room, you know. So you don't want to stay if you know it's bad. Anyway, they're really good, and if you've got a situation until you can either get out of it, clean it, the candles work really well
Right.
for making the air in the room that you're in.
Yeah. Well, and I've got, a million other questions to talk about, other things, to travel with, or, ionizers versus purifiers. And in my world too, Dr. Dennis, I use all these things. I've got a purifier going to remove particulate. We use an ionizer occasionally. I've used ozone successfully. That's controversial sometimes in the mold world, but the candles, I think they're just all tools. But I think that the one thing, we mentioned this at the beginning too. I don't think we'll have time to talk about it, but in the mold world, there's all these different camps. There's the Shoemaker camp, there's the Andy Campbell camp, who's completely different and very anti-urine testing and things like that. But I think that you and I are on the same page of like, well, we all agree that we need to breathe cleaner air. And
That's right.
so what
It's
are
the
the
same
tools?
thing. You got to fix the air.
Exactly. So what are the
Doesn't matter
tools
how you
for that?
measure it.
Yeah,
You
and
know,
HEPA filtration can help that. Cleaning the HVAC system can help that. Ionizing the candles, anything can help that. But the goal is the same: breathing cleaner air.
that's right. If you don't get your air right, no therapy works for you.
Yeah.
You'll know
Well,
because if you're doing all the therapy and you're not getting better, okay, where is the fungus? It's your responsibility to find it and fix it.
yeah. And I would say in my own case, my hypothesis would be that I was exposed to mold 40 years ago and it started all my ENT issues.
Uh,
And obviously I've moved many times and things like that, but I think it kickstarted all my issues. And I just wish that somebody like you would have existed, 40 years ago and had told my parents, look into your environment a little bit more. But
well, I was
they
there 40 years ago.
but you're still rare. You're still a bit of a unicorn. And we were living in Atlanta, Illinois, not Atlanta,
Yeah,
Georgia, so it's a little different place. But yeah.
I've
So
been doing this 40 years already. So
yeah. Well, that's amazing. And yeah, we appreciate you and the space that you hold in the mold world and just the education to Dr. Dennis and the products that you've developed. And last thing I'll say is again, I think the EC3 is more than anything else. I mean this literally. EC3 is one thing that most people I've seen in the mold world agree on. Most testers will recommend it. Many experts and gurus and podcast hosts and things like that. I've never really heard anybody not agree with the use of EC3. So I think you've done a great job with the development and the evolution of that product and its usefulness, but also just in the education of letting people know why they need that, why it's important, how it can be used. That's where people like me try to come into play and teach people about these products and about these mechanisms and understand them a little bit better. Because when you understand the mechanisms, the solutions become more obvious and evident. So I think kudos to you for everything you've done with that.
yeah, and they work, but also they're not toxic. So that they're not toxic. That's important because you knew somebody's going to drink it. And I thought it was going to be a child, but it was an adult. This lady drank 2 cups of coffee of EC3. And, like it was accidentally, but she called as an emergency, thought she was going to die. I said, no, you'll be fine. So she never got sick, never got nauseated, never had any other symptom. But she used the water that, how you have to mix it. You mix it with a gallon of water.
Mhm.
Uh, well, her husband had mixed it with a gallon of water, but he left it in the water bottle. So he went to take a shower and she gets up to fix coffee and uses that water bottle. So it was EC3.
Yeah.
And so it just proves that if you drink 2 cups of it, it doesn't hurt you.
Yeah.
It's really good to have a product that's not toxic.
Well, and again, coming from a surgeon who uses steroids and medications and things like that, you're not saying you can't use any pharmaceuticals or, but if you can find something natural, if you can find something that's non-toxic, let's go for that first. And then we'll use the big guns when we need to. And a lot of times there's a time and a place for those things. But I like you that you kind of blend conventional medicine with natural medicine too, and just say, hey, there's a time and a place for both of them, but what's our intention? Are we trying to kill mold? Are we trying to neutralize mycotoxins? Are we trying to restore mucosa? Are we trying to reduce toxin burden? Are we trying to breathe cleaner air? And I think I agree with you with all of those things. So yeah.
Now there's the ionizer. Actually, they have. I don't know if you've got the one that the Israelis did.
I
It's
got the one that you recommended.
decent. There was the one I did on a podcast, but then after that, several months later, they actually improved it. The Israelis uh, made a better one than that one. If
Okay.
it was on a podcast.
Well, I got the one that you recommended.
Okay.
But then I found out from a friend of mine who's he's a pediatrician, Dr. Pejman. He found a place where you can get it for like half the price
Yeah.
because mine was like $800 or something. But what the Israelis
Well,
do?
it's called a D6 sterilizer,
Okay.
and it's equivalent they made it in Israel, but they sell it over here and it's got another name. But if you look that up, you can find it. Anyway, it's self-cleaning. That was the key. See,
Okay.
the other one wasn't self-cleaning, so you actually have to get one of those air cans with a wand on it that you clean the
Right.
computer, and you have to spray off. It's not a big deal, but spray off the ions maybe once a month or
The
so.
dust, yeah, because the ions are sticky, so the dust sticks to that fan.
That's right.
Yeah.
And so these guys developed, first of all, it was rated for 6,000 cubic feet a minute. Think about that. That's like an industrial size fan in a office building, you know. So it'll take up 6,000 CFMs, and it was self-cleaning. That's what pull me to it. So I'll call the guys up and talk to them a long time and show them some slides and everything. And so uh, we started installing those in everybody's HVAC system.
I'm seeing the duct unit and things like
Yeah,
that. I'm looking at
and
it.
put them in the fans. There's nothing wrong with the one you got. It's just you got to keep it clean.
Uh-huh.
That's all. There's nothing wrong with it. It's just the next step. Somebody's going to make it so you don't have to clean it. They
Yeah.
did. You know,
Yeah.
that's the
Cool.
only difference. And
Cool.
it's a little bit more powerful. So if you fill up the room with positive and negative ions, now the key is you can't have ozone, you can't have hydroxyl. Why? Because it destroys the cilia. That's why. Now ozone is a good mold killer and detoxifier for sure, but you don't want to be breathing it.
Exactly. That's right. Yeah.
You know, so you want to put it in its place. It's not for the human to take in ozone. Now, I know you can put it in your or take your blood out of your body, put it through ozone, kill everything, put it back in. That's fine, but you don't want it in the air breathing
Right.
it.
Yeah. It's noxious to the epithelium.
Right.
Well, and that's exactly my experience with it too. I had a formaldehyde issue in my office from carpet that got installed. It took me a couple years to figure it out, but every time I would ozone, I would feel better. And I thought it was mold. I was looking behind walls and looking everywhere. I thought mold, mold, mold. My body's reacting to something. Turned out it was formaldehyde, but the ozone really, really was helpful. But the ionizer is just again another just tool
The
that
ionizer would do the same thing, but it's take longer.
okay.
You just put it in and never turn it off, or just get rid of the carpet.
Yeah, well, exactly. Yeah, yeah, yeah. All right. Well, I'm gonna let you go. Just don't take too much of your time, Dr. Dennis. I appreciate the time for the interview, and I could keep asking you questions like this all day if we didn't keep
Well,
our eye on the
you
clock
can
here.
ask me a few more. I got a few
Okay.
more
All
minutes here.
right. Well, then, gosh, let me think about some more. What is uh? Let me look back at my notes here too. But what is your go back to the ionizer? What about different treatment, camps that are out there? What's your opinion on that? Again, I think that you are just different, that you're doing ENT treatment. That's what you focus on. You're just thinking outside of the box of just surgical removal and things like that. But the Shoemaker camp and the Marcons, and things like that, that camp teaches versus the Andy Campbell versus the Neil Nathan, I know which one you lean more towards, but I'm more of like integrating all of those. But what's your opinion of those opinions, I guess,
I
in our
think
world of mold
I
toxicity?
think you got it. do what works for you. Uh, I think that mold is the main issue in causing chronic illness in a lot of people. It's at least 20% of the population. So if your air is not clean, you're going to get sick. And you want to fix your air first. That's what you can do that no doctor can do for you.
Mm-hmm.
You got to do that first. If you get that right, then all the herbals and all that stuff helps you. But otherwise, you're just wasting your time and money. So there are three things that are used as diagnoses. There's the biofilm group. There are biofilms, no question about that. And there's the Marcon group. There's Marcons. Everybody knows that. And then there's the mast cell activation group. And all these are separate diagnoses everybody's focused on fixing. But it's all just one thing. Mold causes all those things. So if you fix the mold and get it out of your air and your body, all those other things go away without treating it the way they want you to treat it. So they're gone.
Yeah.
And so biofilm, so just to understand, biofilm is there, and it's there because there's inflammation. So what causes it? Well, the fungus comes in, and you have an immune reaction, which makes a pit in the lining. Well, they're microscopic, you can't see them. So the little pits trap mucus, and then you get bacterial overgrowth. And then you get this lab upon which to build the biofilm because of all the little perforations in the mucosa. But if it weren't for the mold, you wouldn't have those perforations, so you wouldn't have a biofilm.
And if you test it, it might be staph, but there might be other species, and
There's all kinds of stuff in there.
the mold was the root cause. Is your point?
That's right.
Yeah.
Well, staph's in the nose anyway.
Right. Yeah.
So staph's in the nose all the time. So somebody starts talking about Marcons, that's just methicillin-resistant staph. Okay, so staph is a normal organism for the nose in all humans. So it's like saying, oh my goodness, this guy's got E. coli in his colon.
Hmm.
Yes, it's supposed to be there, right?
Right. Yeah.
So the reason is methicillin resistance because all these people have been treated with multiple antibiotics. That's why it's there. So you never have to treat Marcons unless what? You have active infection, meaning you have purulent discolored drainage. If you got clear mucus and no symptoms, you don't treat it because it's there anyway. They culture it and they start treating it because it cultures positive. Well, that's going to be never ending. It's going to be forever.
Right.
You know?
Yeah.
So, and then mast cell activation. Okay, now that's a whole other thing. Mast cell, that's a synonym for the word allergy. Okay, so if you have an allergic reaction, you first have to activate a mast cell. Well, the question to ask is, what is the antigen activating the mast cell?
Exactly. Yeah.
It's the fungus. So you don't have mast cell activation unless you have antigen. So treating all the symptoms of mast cell activation, there's nothing wrong with, trying to numb down the symptoms, but get rid of the cause.
Right.
The cause is the fungus.
Yeah.
So if you do get rid of the fungus, you get rid of what? You get rid of you don't get rid of Marcons, but you get rid of infections. You get rid of mast cell activation, you get rid of biofilm. So that's my lecture for the day. Just focus on the fungus. Get it out of your air, get it out of your nose. You don't have to worry about anything else.
Yeah. Well, I completely agree. There's also even a new, I've got it over here. I can't even remember what it's called. I haven't read it yet. It's called the cancer resolution, but there's this new, there's theories about mold and fungal things being the root cause of cancer and other, chronic diseases.
Well, that's true.
Yeah.
Now this is, Dennis Hooper did this test. If you go into a pathology lab, and he was a pathologist, and you take all the cancers that came in, they're 100% sure this is cancer. The tissues diagnosed as cancer. What percentage of those cancers, liver, spleen, bone, brain, liver, stomach, all of them, all the group, what percentage of them have mycotoxins that are known to cause cancer in the tumor itself? What percent?
100.
87.
87. I knew it was high. I've heard this before.
It's only 87.
Only.
So that means we don't have to worry about it, right?
Sure.
So, so if you fix the air, you're certainly going to impact malignancy. How much? Nobody knows, but
Right.
start there.
Yeah. Yeah.
If you don't have, and I think all oncology clinics should have a urine mycotoxin. Yes or no? If it's yes, find out where it came from so you can have a success rate in fixing it,
Yeah.
right?
Yeah. Well, and I've heard, Dale Bredesen and people talk about Alzheimer's and say mycotoxins are a hidden epidemic driving the Alzheimer's,
That's true. And also,
increase. So
I've got, you've seen those pictures of people with Parkinson's before and after
yeah.
that I've had.
Yours.
Yeah.
Yeah. Yeah.
Okay.
But tell
So,
tell us about them though.
so, I had I have 3 or 4 Parkinson's patients. They didn't come to me for Parkinson's. Don't get that out of it. They came to me because they were sick from mold. They knew it was mold. That's why they came to me. But uh, when you've got Parkinson's, now they had good neurologists and the right medication,
Sure.
but it wasn't helping them much.
Sure.
It made them better than they were, but they were still uncontrollably in tremors.
Progressing.
Yeah, and so they got them out of their house, and I operated on them and cleaned their sinuses out so they wouldn't keep feeding it 24/7 from the spores in their sinuses. And both of those patients got total remission of the tremors. The zero, not a little bit, zero. So certainly some of Parkinson's is due to fungus. We don't
Yeah.
know how much.
Well, and you and I there's a lot of different mechanisms. The mycotoxins get into the basal ganglia
That's
and
right.
can access that. Ochratoxin is affects dopaminergic signaling, and so dopamine is involved with Parkinsonianism, and
That's
so
right.
there's a lot of mechanisms involved. But that's just fascinating because you see it and it works. And let me ask you this, if you have a sec to talk about it, tell us about the surgical procedure or procedures that you do because you're flushing out the sinuses with, and I forget, but with maybe amphotericin or different antifungals
Or
in the.
voriconazole,
Okay.
either amphotericin or voriconazole. But
Okay.
the key is the device is called a cyclone.
Cyclone. Yep.
And Stryker's a famous company that makes all
Sure.
kinds of surgical supplies for all specialties. And it's got about 6 ports in it. And it's got a suction on the tip of it. It's malleable, so the sinuses are all at different angles.
Hmm.
So the frontal is almost a 90-degree angle straight up. It's not quite. And so the maxillary and the frontals are the same angle.
Sure. Yeah.
Okay, it's like a right angle. And then the sphenoid and ethmoid are straight. It's a straight line, straight back. So when you have to surgically, you got to go to sleep, anesthesia. You got to open all the sinuses with a telescope. And then there's a device that does all that. It cleans it, sucks it out, and makes a tunnel, and you clean all that stuff out. Once you got everything open, then you put that cyclone device first into the frontal because it's got to be curved. And you're on a high pressure with somebody just bearing down on a 60 cc syringe, just pushing as hard as you can push it. And at the same time, we're sucking it immediately as it comes out. Immediate, it doesn't go anywhere. And then you do 260 cc syringes for each sinus. Really hard. And it is pristine. Then you got like a pristine glass that just came out of the dishwasher. And it's like a porcelain bowl in there. So all the 8 sinuses are clean like that. Without the powerful irrigation using an antifungal like amphotericin or voriconazole, it would not work. Surgery by itself will not work.
Okay.
You have to irrigate each one with pressure and suction, or it won't work.
And antifungal. Okay.
Yeah, the antifungals that's what you irrigate with.
Right. Yeah.
So that's the thing that was the trick. And what I wasn't like the smart one that figured all this out. I was, I was operating one day. The reps come in from time to time. We didn't invite or anything, but when they have new products, they come to tell you about them. So I irrigated all of the sinuses my whole life. I irrigated every sinus with the usual thing you irrigate with. So one stream of water and then you suck it out. Didn't work, but it worked a little bit. You know?
Or
So this
temporarily,
guy
or
says, "Hey doc, try this thing." So I didn't ask for it. He just showed up with one. So I tried that and cleaned out all 8 sinuses with it. I really liked it. So that particular patient had a deafness in the left ear for 10 years. So I would bet you try to fix that would be impossible, and I would bet you $1 million you could not fix that. No way could you fix that. So the guy in the recovery room, when he wakes up, he's bouncing around yelling that his hearing is back in his left ear. Now I would bet you it's impossible. Now I would still bet it's impossible, but I saw it.
exactly.
It really happened. So, in other words, that's what was causing his chronic hearing loss, but it didn't totally destroy his nerve yet,
Yeah.
you
Which
know.
that's the hope for my olfactory nerve too. That's not totally
Y-
destroyed, but yeah, that's fascinating.
Yeah, so you might benefit from that, to irrigate with that.
Well,
You have to,
I when I was really sick living in mold, this was maybe 5 years ago, I had an appointment at your office, or I had called and I talked to your front desk. I filled out the paperwork. I was considering coming down to Atlanta and things like that. I'm super intrigued still, even though I've would say that my sinuses are again 10 times, 100 times better than they used to be. I'm
yeah.
still very, very intrigued. I doubt they're pristine in there, like you
Well,
said.
you probably ought to start at home, just irrigation,
Well, I do that. Yeah, I do
and
that regularly.
put a little amphotericin in there
Okay.
and irrigate with it. Now the dose is really 3 milligrams per 30 cc's, but I would do it a little bit weaker than that.
Okay.
And it has to be, there's the kicker. It has to be water, not saline.
Okay.
Now, warning label, it'll burn a little bit.
Okay. It's fine.
Now people can't do this at home. Now, we do this in a nebulization,
Hmm.
but irrigation would be good to do too.
Okay. Okay.
Irrigate with it. And if you get have you had sinus surgery?
I've had two.
Okay. So you probably open. So if you irrigate, you can probably get it in all your sinuses.
But it was more of a septoplasty. I don't know what they did opening the
Oh,
sinuses.
okay. So you do need it. Just tell her, we just call her back. Say, I need to see it. I'll tell her. Get
Okay.
get a CT and send it down here.
Okay.
A sinus CT.
Okay. I'll see what I can do. But thank you. I appreciate the offer.
Uh, anyway, so you want to do irrigation with this with the cyclone. It's got high pressure, and it's think of it like this. It's the difference between washing your driveway with a hose versus a pressure washer.
Oh,
Which would be better?
right.
You
Makes sense. Yeah.
it's like night and day. You can't do that with a stream of irrigation. It doesn't happen.
Yeah.
It's got to be pressure.
Well, and it makes total sense. And it's like adding an emulsifier in there with adding the amphotericin or the antifungal agents. It's not just water and saline. But yeah, that makes a lot of
So,
sense.
so the guy that invented that thing, he's an engineer.
Hmm.
I called him and told him what happened. I sent him, like a video of some people that started walking and they were just paralyzed and all this. And so he came down here and wanted to take me to supper and all. I said, "This is what you did. You invented this thing that has a lot of application in ENT, and the guys they're just using it to wash out an infected sinus with pus in it, but it's much more than that. It really gets the toxins out of every sinus better than anything on the planet because it sucks at the same moment. It can't
Yeah.
go anywhere.
Okay. What about if you have another sec? What are some other, you've mentioned this a couple of times, and I've again seen you speak many times. I've seen some of your pre and post, but what are some of the crazier stories? Parkinson's, you just mentioned that's pretty crazy. People who couldn't walk, deafness. What are some other things you've seen? And I think that all of this, some of your crazier stories is because the brain is in such close proximity to the sinuses. You know,
Yeah.
if there's a fire in one room, you're gonna feel the heat in the other room. But so many people have these neurological things or pituitary things. So, and feel free to cut me off at any time, Dr. Dennis, because I know that we're going over, the time. But what are some of the crazier stories that you can think of?
Well, what if I let you? What if I let you hear it from a patient? Would that
Let's
work?
let's hear it. Yeah, if we can hear it, yeah, that'd be great.
That's
Because I in the mold world, you hear crazy stories. I hear crazy stories every day,
okay.
and
So
they're
listen to this.
amazing. But I don't think they're as crazy as
This
yours.
this, this is from the patient's mouth.
Okay.
Suicidal.
Right.
My symptoms were suicidal depression as well as anxiety. My treatment was numerous SSRIs, tricyclic antidepressants, as well as SNRIs. I also received just under 20 electroconvulsive therapies to my brain to help to treat depression. I also was institutionalized for my condition, and I was considered to be treatment resistant. I recently just had sinus surgery with Dr. Dennis, and it has completely revolutionized my psychiatric condition. I am no longer experiencing any depression, nor am I experiencing the extreme anxiety. I feel as if he has saved my life, and I am no longer on any psychiatric meds. It is a complete miracle. Thank you, Dr. Dennis.
See, that's where I go. See, that's where I go to work every day.
Exactly, exactly. It's so cool because I see it all the time too, and it's so fulfilling, and yeah, you got a great purpose and things like that too. So
So she had three little kids, and she was totally disabled,
yeah,
couldn't do anything. So it presents in all kinds of ways. It's basically a brain toxin. It's treating all kinds of. It's like a pinball machine. Where is it going to hit in the brain? And that's what happens.
right. And if it's in your amygdala, you're gonna get
Yeah.
fear and anxiety. If it's in your pituitary, you're gonna get pituitary symptoms or hormonal symptoms or things like that. It just kind of depends on which area it's hitting. But
Well, the other thing is, with artificial intelligence software that you saw on one of those things, we can see the mycotoxins in the brain on an MRI scan, and we can see what things remove the toxins from the brain. Uh, but the key is, we had a patient that came in with a 140-pound weight gain in 3 months. Think about that.
right,
And so I'm thinking she's pounding the pie. And so she says, no, listen to me. I'm a yoga instructor. This is my diet. I said, well, then you've got a tumor. So I sent her to an endocrinologist, and she had she had Cushing's disease. So she had a tumor in her pituitary that was making large amounts of cortisol, causing the weight gain. But if you didn't take the tumor out, eventually it would result in death. So you had to get the tumor out. So I cleaned her sinuses out first. Neurosurgeon took the tumor out through her nose, and we got a piece of the pituitary tumor, which is brain. Pituitary is part of the brain. And so we got a piece of the brain tissue, and we did mass spectrometry on it twice to make sure it was right. It had 11 mycotoxins in it.
mm,
So the point is, it's a soup of stuff. It's not one or two. It's a pinball soup of stuff from the environment, like you'd expect.
and there might be metals or other toxins too. But
Yeah. And so, and then she got totally well and got back to normal body weight and is normally functioning. But it took a year. But the thing is, without the surgery, both sinus and pituitary, she wouldn't have survived. And she was
mhm,
young. So it can present in any way you can think of. Basically, it's poisoning the system in many different ways.
right.
Knocks out your immune system, so you get everything else. Then you got 3 or 4 more diagnoses. You know,
Autoimmunity, that's the focus of my podcast. But
yeah,
yeah,
yeah. Autoimmune, it knocks out your whole immune system, and then you get allergic to everything, including yourself.
yeah, and that's the
Yeah,
mast cell activation. And
yeah,
you published the study, years ago about the pituitary, study with the HGH deficiencies and other pituitary, I forget all the findings of that. There's maybe 79 participants, I think you know what I'm talking about, but it was a
yeah,
pituitary study that you published. But yeah, that's fascinating.
yeah. So I knew these patients were. I knew they had growth hormone deficiency. I'm not the endocrinologist, but I knew that because they weren't healing properly.
Uh-huh.
So I called the endocrinologist and I said, "Look, These people, I think, have got pituitary damage, and I don't think they got growth hormone. So they do the blood test, and all of them had normal growth hormone levels on the blood test. And so he didn't do any workup. And so I kept seeing and said, look, just humor me. I know that these people are growth hormone deficient. Do a stimulation study and see if they can make it. Just humor me. Just do one. So the first 13 couldn't make it. Now, they never saw 13 in their life in a row. Because in their world, they're going by the blood test, which is totally worthless for this. So you got to stimulate them. And some of them, either if you stimulate them, they can make it, but they can't make it without stimulation. See what I mean?
Mm-hmm. Yeah.
So they're still deficient.
Yeah.
Or they can't make it at all. Then they got to have the injectable. But if you don't fix that, they just have accelerated aging and they die. They accelerated aging because they can't make new cells. You have to have growth hormone.
Yeah.
So the whole growth hormone world is owned by the endocrinologist, and they don't know this. Even though that I published a paper, nobody reads it. So they need to. All these patients need to work. The normal levels in endocrinology are not normal. That's the lesson, and especially if they're low normal. So all these patients need to be mid-range and everything, or need to be mid-range.
Yeah.
Not low normal. They don't do well with low normal. And then you got to do it slowly. You can't do it fast. You bring them up to where they should be. But almost everybody that has mold toxicity has some level of pituitary damage, and one or more hormones are not at their peak level.
Well, and even that's the whole backbone of Sears as a model, the MSH and the different hypothalamic pituitary signaling and the downstream effects that can come from that. So we're all kind of saying the same thing. They just have their stepwise treatment protocol, but it makes sense.
You want to fix the reason they have it.
Right.
And not just try to fix the symptom, because you're going to fail doing that. Yeah. You got to get them out of the toxicity.
Yeah.
So that's a harder job. When you got the physician has to get involved environmentally, that's way hard, and nobody's going to do it because it's too time.
Or sometimes, testing has its limitations, whether it's plate testing or it's air testing or it's spore trap testing or whatever the case is, it just all has its limitations. But that is the most important. If somebody in my office is not getting well, then I think, well, what are we missing environmentally? What are we missing environmentally? What have we not found testing wise? What have we not, looked into? Because I see so many people that say, "Oh, I had my house tested for mold. There was nothing."
Yeah,
why are you still sick?
You can have nothing and have a toxic level of mold in your house.
Exactly. Yeah. Or people come in, this, inspectors come in, they look around, they're like, "Oh, I don't see anything. Looks clean." They don't actually test anything.
Or the test doesn't show anything, or it shows it's okay. In other words, their level for okay is not okay for that person.
Right. Yeah.
And so I think the mold dogs have a place.
Really? I'm glad you brought that up. Somebody locally in my area, I'm in Illinois. Somebody local in my area is just starting to offer that service. I've never had any experience.
I think the mold dogs have it. Here's the way it is. The mold dogs can find stuff that all the equipment doesn't find. That's a fact.
Right.
So you sort of need both. You need both detection, then you don't miss anything.
Exactly.
But if I was going to buy a home or something, I'd have a mold dog go through it, and I'd mold plate it myself. So we tested a lot of these patients. See, first of all, just like you got that history, we've had inspection. We're good. So I don't listen to any of that stuff. I tap my own patient's clothing. The nurse, that's part of the intake, like high blood, pulse, temperature. We do this. We tap their clothes. It takes, at least 5 seconds. You tap the front of their clothes, back of the clothes, and you cap it. In 3 or 4 days, you got stuff growing. I send it to the lab so they won't have to believe me. It's sent to the lab so I get a report. Many, many times when everything's been done known to man, to the house, they had good people do it, they're still full of fungus. And the 3 low-hanging fruits are Front loader washers, you can't have one. Check that off. You can't have one. Top loaders that do not have an agitator, you can't have that. They're all full of fungus. You can't fix it. The one you want to get is a Speed Queen TC5. I'm going to say that about 10 times. Speed Queen TC5. We've done a lot of clinical work. This works. It doesn't get mold. You leave the top up. You put a little desk fan in there when you're not using it, and it will never get mold in it. Okay. Then sleep number beds that put air in the mattress. You can't have those things. They'll get mold inside. Now, you won't smell it. You won't see it, but you'll be getting toxicity. Okay. I know because I had one. And then I had a big lawsuit about that, and they started giving you a new bed. But their solution wasn't elegant. They just put all, the antimicrobial that stick in clothes now that they shouldn't have in them.
Right.
And they put that in there. So
then you're breathing that.
Then old cars. Oh, meaning, you get some 8 or 10 years old, especially if it's in the South, where you have to use air conditioning in the car.
Sure.
Well, think about what that means. Well, the air's coming in from outside, and you're making it cold, so the whole car is wet, and it's blowing the cool air in your car. So, wet, dark place, what's going to happen? You're going to get mold growth in there. So, and you don't necessarily smell it, but you're getting a large amount of fungus all the time, and nobody's figured out how to fix that.
Right.
So, ultimately, they all have, how you change a battery? It needs to be like that.
Yeah.
You need to be able to jerk the thing out of there, stick another one in on a routine maintenance. That's the way it needs to be designed. So you have disconnects with the coil and all that stuff.
Sure.
You're able to do it scientifically, but they don't realize the problem,
Yeah. Well, those are interesting, even just the low-hanging fruits, because again, it's not always bathrooms, crawl spaces, burst pipes, or things like that. It's like, well, what about your washer? What about your car? What about your clothes?
And your bed.
Yeah, in your bed. Yeah, exactly. Yeah. And again, when I had my house mold tested the first time, or moved into a new home, or it was built in 1856. It's not new, but the highest thing was my twins' mattresses. My twins girls, their mattresses were really high, so we got rid of those.
You
right
still
away.
in there?
Yeah, we're still in that house. Yeah.
It's 1800.
1800s. Yep.
Well, they knew how to build them back then.
Well, yeah, it's hand hewn logs. It's definitely not
because they didn't have
airtight.
air conditioning.
Yeah.
But where do you live?
In Illinois.
Okay, so that's cold and hot too.
It's humid. It's hot. It's been 100. It's raining today, and yeah.
Okay. All right, I'll send you the two. You need two guys that I use to look at your place.
Okay. Well,
what's your mold count when you put a plate up?
We have first off, we have a really good inspector. We have a really great inspector that we trust.
Okay, good.
That dives deep, and he's come out to my house, and that's who tested my mattress and tested some wall cavities and dug around in my crawl space and all the things.
You opened up the HVAC unit.
Absolutely, absolutely. In fact, the next family I'm about to see, because I'm gonna have to go here in a minute, but the next family I'm about to see had a spore count of 400 Stachybotrys under their kitchen. He tested that house just a couple months ago, but I trust my testing guy really well. But it's
if they got Stachybotrys under the kitchen, I would move.
Exactly.
Okay, I'm done. I would be gone because you can throw 200 grand at that and not fix it.
Oh, geez.
For the same reason I told you, right? Because of mycotoxins.
Yeah, and the wood.
Or into the stuff.
Yeah. Well, great. All right. Well,
you can have a good mold report and have a toxic house.
Absolutely, absolutely, and I see it all the time. And I've got stories of families with 9 kids or 11 kids or different things where like everybody's getting sick or multiple people in the family are getting sick. I mean, same thing with this family that's about to come in here in the next 20 minutes or so. But I see it all the time. But I also do see great results. I see people get well from it all the time.
You can get mycotoxin testing for your dusting.
Oh yeah, I've done
sparkles. Real-time labs.
Yeah, EMA tests. We do EMA tests. Yeah, we do all those things.
Okay.
Yeah.
All right.
But yeah,
nice talking to you.
It's intriguing, and again, it's a fascinating industry. And I think that you'd be, I think you'd agree with, you know, even our mold testing guy. I think you'd agree with all his practices and things like that. But even sometimes he doesn't find everything, or sometimes it's behind a wall, or you can't smell it. So the dogs have values, the plates have value, but always just kind of looking
Is your
for.
house built up off the ground?
No, I have a basement.
Okay.
And my crawl space has been completely tested and been completely moisture sealed and all
Is it
those.
dirt or is it concrete now?
It's dirt in an area, the rest of it's concrete. There's like a sub crawl space behind there. But I did have some there's a secondary crawl space where there used to be a coal chute, and there actually was some mold in there. And I had that remediated. It was old, it was not current growth, but it was on some of the beams, some of the floor joist beams. So I had that remediated and cleaned out. But that was the only marker that was even remotely high. And it wasn't spore count wise, it wasn't super high, but we still had that addressed a few years ago.
Did you ever have any water in there?
No,
Okay. So where is the HVAC unit located?
in the basement.
In the dirt part?
The air conditioning, the air conditioner is outside, but the HVAC system and furnace is in the concrete part. It's not in the dirt part.
All right. So where did you put the ducts?
What do you mean? I don't know.
You know, you have to run ducts in the house. Are
Yeah,
they inside the wall cavities or where are the ducts?
they're inside the wall cavities.
Now, so who insulated the wall cavities?
I don't know. Before I bought it.
Okay, because you know in the beginning, what they weren't insulated.
Yeah.
They didn't do that back then. There wasn't any insulation. You know, so yeah, that would be interesting to know what's in
Well,
there.
yeah, I'd be interested to know what's in there too.
So so it matters because if the ducts are inside the wall cavity and it's not properly insulated or wrapped, then in the summer that's sweating
Right. Yeah. Yeah.
inside the
Yeah.
wall cavity, and you'll have mycotoxins coming out everywhere.
Yeah. And we see that in the Southwest, you know, when it's really
Yeah.
hot outside and cold inside, and there's a condensation in the wall cavities and things like that. Um, but yeah,
You just some more stuff to look at.
exactly. Yeah, exactly. Always looking at it and always trying to just, again, as you said, breathe as clean an air as possible. And it's something too that just because I had my house tested a few years ago doesn't mean it's clean now. You know, it's always got to keep your foot on the gas with it, with the upkeep and the maintenance and things like that.
Also, the way you can tell is what is your cognition score is 10's normal, what's your energy score is 10's normal.
Exactly.
If you're getting down, you know, 7, 6, 5, then something's bad wrong.
Exactly. And that's exactly what happened to me. Because in my previous house, because I had a practice in Salt Lake City for 7 years. I sold that practice, moved back to Illinois, rented a house for a year, and that house had water damage and was moldy, and I got really sick. So I had nasal polyps, I had
Yeah.
asthma, I had hypersensitivity pneumonitis, I had anxiety, I had uh you know, all those things. But I feel pretty stinking good right now, so I don't have any cause for concern
Okay.
environmentally, but it's always on my radar. Same thing with my building, you know, this office building. It's old, it's big, it's got 4 different HVACs. I mean, there's a million different concerns here. So they're always spinning in my head, but you got to be aware of them without being overly fearful.
That's
But I'm,
right.
but I'm always
Just gotta be
thoughtful of that.
scientific about
Yeah,
it,
exactly. And yeah,
not
yeah.
unemotional. Now, one other thing we didn't say real quick. Almost all these patients who have chronic illness like this have, along with cognitive dysfunction, they've got brain damage in the sense that when you do a QEEG on them,
Which
it's
I
abnormal.
we do QEEGs in my practice.
It's abnormal to have high voltage in an area, it's more areas, and it causes disorganized thought processes. And
Yeah.
typically, it causes severe anxiety, depression, and way bad OCD about hunting for mold, and mold's everywhere. Is, you know, so you have to do neurotherapy on those, or you never stop that behavior. Even after you take all the mold out of the house and out of the person, they still have it.
Because they have the neural patterns.
That's right. So
Yeah.
you have to do neurotherapy. And it takes about 2 or 3 months to get rid of it, but it works really well.
Yeah, well, and that's
Just do it.
fascinating. And I'm glad you brought that up because you've shown in some of your PowerPoints and presentations where I've seen you speak, you've shown pre and post QEEGs. And so
Yeah.
we do neurofeedback QEEGs in my practice. Now I don't, but I have a counselor that does that and things like that. But that's fascinating. I'm so glad you brought that up.
All those
But
people
yeah,
need neurotherapy.
yeah.
If they have mold toxicity, just get them neurotherapy once you get them out of it.
Okay. Well, good. I'm glad you added that in. All right. Well,
All right.
thank you so much for your time, Dr. Dennis. I love hearing you talk. I always have and will continue to. So keep doing what you're doing. I appreciate you and appreciate the products you've developed and everything about, your purpose and your mission. So keep it up.
You're welcome. Thank you very much.
All right. Thank you. We'll talk soon.
All right.
Have
Bye.
a good rest of your day. Bye.